At almost every stage of this pandemic, technology has played a major role in keeping us going. Can't go to the office because of the lockdowns, work with colleagues over Slack. Need hand sanitizer or a face mask, order for next day delivery on Amazon. School or university closed, while classes are now happening on Zoom. From the mundane, everyday aspects of life, grocery shopping, entertainment, chatting with friends and family, to the much more difficult task of trying to track and control this virus, big tech has been front and centre. But in a world where technology has already been developing too fast for regulations and even academic expertise to keep up, it seems the pandemic has left us scarily exposed to the pitfalls of a sometimes excessively automated and computerized world.
Algorithms, big data, artificial intelligence. These days the tech industry seems to have a fix for almost every problem we face. And while many of these tools have made our lives immeasurably easier, more efficient, even more fun, we've also come up against something called technological solutionism, a concept that sees technology playing the superhero and saviour in almost every situation. Tech writer and intellectual Evgeny Morozov has been writing about it for years.
So it's something that I saw as a dominant trend in how we think about the potential of technology. And the way in which we think is defined by and large by the technology platform. So Silicon Valley and digital culture that Silicon Valley has created. And by and large, this is an imagination that's very constrained. It imagines problems that are very narrowly defined. So we're being told, for example, that climate change is the product of us not turning off the light, or we're being told that, it's the consequence of us not recycling properly. And since the problems are defined in this rather narrow way, it's very easy to think of a solution that will solve them. And that solution would normally come in the form of an app, and that app will essentially try to address something that's relatively low-hanging fruit. It's a small tweak in how users or citizens behave. It does not tackle any of the more structural, more fundamental, more difficult parts of the political process. And it's something that also earns the companies behind the solutions quite a lot of money. So with this mindset, it's of course not surprising that the current crisis related to COVID-19 has generated an abundance of solutionist technology.
One of the most urgent problems in the early days of the pandemic was how to track and trace the spread of the coronavirus. Think about the sheer size of that problem. For every infected person in a city or country, information would need to be gathered about where they'd been recently or whom they'd been in contact with. If there were people who'd been in close contact with the COVID patient, well, then they'd need to be found and advised to self-isolate or to take any other health precautions. And let's say if one of those people are found to have developed symptoms, well, then the process would have to start afresh.
Clearly, contact tracing is cumbersome, and when you have to do it at scale and with speed, it can seem a near impossible task. This makes it appear like the perfect problem for technology to take on.
So contact tracing is an extraordinarily old and very sensible way of going about tracking and tracing a disease.
I spoke with Sean McDonald, who has spent more than 10 years building, deploying and critiquing mobile technologies in humanitarian disasters such as infectious disease control.
When a patient tests positive, we interview a person to know where they've been during that period, and then we use that information to try and track down other people they might have had contact with. In terms of the big change in contact tracing apps from analog to digital, is that we're moving from a process that connects people to treatment to a process that communicates risk. And communicating risk in the absence of treatment capacity has a very different effect on a population. It can cause fear, it can cause people to go seek more treatment than they otherwise might. And so I think that there's a lot to be examined about the fundamental sort of assumptions that go into the digital transformation of contact tracing.
That hasn't stopped governments and health authorities from jumping on board. From Italy to India, more than 150 phone app-enabled systems have been developed to track the spread of COVID-19. Some researchers claim that in places like South Korea and Taiwan, they have helped identify COVID hotspots and the close contacts of patients. But as Sean points out from his own experience monitoring Ebola in 2014, no technology is perfect. Certainly not tech that is rushed out at the height of a pandemic under the pressure of politics and the threat of bad publicity.
In the Ebola response, I think it was very early days in understanding a lot of the role that algorithmic modeling can play. And I think that just like we're seeing with the COVID response, good intentions are everywhere. But good intentions are not good science. Rolling out a series of apps that are meant to provide a coherent overview of something as complex as the transmission of a disease is no small order in the best of circumstances. And so not only do we not have the sort of facility to evaluate the technology itself, but we very rarely have the ability to understand it in the context in which it's applied.
During this pandemic, rapid access to data has been crucial in helping to understand this new strain of coronavirus, how contagious it is, what human behaviours encourage its spread, and how effective physical distancing can be.
But the loosening of privacy regulations, and in some cases the outright neglect of privacy requirements, to enable quick access to all this data, has brought on a storm of criticism. Marwa Fatafta is a digital rights researcher based in Berlin.
So obviously the number one major concern about deploying such apps is the privacy concern. What data is being collected, where is it being stored, which authorities have access to this data, for how long are they keeping that data and collecting that data, and is it going to be used beyond its purpose?
In Norway, the government's contact tracing app called Smittestopp went from being aggressively pushed by the state in April to being hastily and very publicly rolled back in June, when the Norwegian Data Protection Authority cited numerous serious privacy violations. Among them was the needless collection of precise location information, sometimes in real time. Other apps in places like Qatar, Singapore, India have all so far failed the data privacy test.
To give people the choice between right to health and right to privacy is a false dichotomy, and it tries to establish a hierarchy of human rights. We shouldn't be making choices, should I save my life and be in good health, or should I sacrifice my privacy? So just to feel that we are being monitored and the government knows about our movement, which people we are interacting with, where we're going, it creates that chilling effect.
Location data is often some of the most re-identifiable data that we create. When added to other types of data, it can be used to target us in very specific ways. So we don't allow just anybody to get access to it. The technology problems that we're seeing trying to be solved are imperfect memories. And that's a very sympathetic problem. I think most of us would agree that we don't want to infect other people, and that if we can help re-identify people more effectively, then that's a good use of our data. The challenge, of course, is that the transmission behavior, because we don't know it, it's very difficult to know how to model it in data in ways that would effectively roll out in technologies. I think that we have a lingua franca for talking about the harms of technology. And so a lot of times what we're talking about is the app private, or is it secure, or is the data architecture centralized or decentralized? The broader questions are we meaningfully impacting the response? Are we helping, reduce mortality? Are we increasing the capacity of responders to be effective? And if we're not doing those things, then is the technology worth letting out of the lab?
Back in March, at a time when pandemic panic was relatively new and felt particularly anxiety-inducing, Israel deployed a contact tracing system that cut straight past privacy regulations. In a move that was unique in the world, contact tracing in the country was not handled solely by the Ministry of Health or a crisis committee. The government got the Shin Bet, Israel's internal security service, involved. Every time an Israeli tested positive for COVID-19, the patient's details, name, ID number and mobile phone number, would be passed on to the Shin Bet. And that's when something called the Tool came into play. It's a classified and previously undisclosed intelligence database that's been collecting information on citizens for nearly 2 decades. Originally designed for national security efforts, the Tool works like a dragnet, gathering metadata from telecom providers, voice calls, text messages, internet browsing history, and crucially for digital contact tracing, location data via GPS tracking or mobile phone networks.
While the content of the conversations and messages are exempt from collection, the abundance of personally identifying information is still clearly too much, too detailed, and unnecessary for the task at hand. Citizens also didn't sign up for the tracking system and, crucially, weren't able to opt out.
I spoke with human rights lawyer Sharon Abraham Weiss, Executive Director of the Association for Civil Rights in Israel.
In the original version of the regulations, the Ministry of Health could ask the Shin Bet to track the locations and routes of those who were sick and everyone that was in their contact with them in the past 2 weeks. The Shin Bet then investigated and transferred to the Ministry of Health the names and numbers of those persons, and the ministry would send individuals in the proximity a message, an SMS, that they must start quarantine for 14 days. It's really strange. Like, imagine my neighbor on the other side of the wall. Maybe we're sitting less than 2 meters from each other, maybe many hours a day, although we haven't seen each other, we didn't speak with each other. I might get a message saying I'm in quarantine.
One of the things that's important about the Israeli case is that they are a very sophisticated technology culture already, and they have very advanced intelligence tools. And so one of the main risks here is that we're starting something that seems like it's aimed in public health and designed at measuring the spread of a disease. And it very quickly becomes about measuring people.
The Shin Bet, the government body itself is very opaque. There's very little transparency. There's very little oversight. There is also, when you are deploying technologies or taking measures that could infringe on people's human rights, there needs to be certain conditions. One of them is having sunset clauses, which basically mean an end date to the technologies being used, and transparent and clear understanding of which government agencies have access to this data and how is it being used.
Civil society groups, including the Association for Civil Rights in Israel, sounded the alarm in mid-March, petitioning the Supreme Court that the country had ventured into dangerous, privacy-infringing territory. Israeli doctors also voiced their objection. In a joint letter to Parliament, the Israel Association of Public Health Physicians and the Israeli Medical Association said the lack of input from epidemiologists and public health specialists raised the likelihood of errors.
By late April, the Supreme Court ruled that the government, which had sidestepped Parliament when it brought the Shin Bet into the contact tracing setup, needed to get this signed off by lawmakers. The ruling also stated that a suitable alternative, compatible with the principles of privacy, must be found. It was a victory, but it was temporary.
Amid a resurgence of coronavirus infections in July, Israel's parliament authorised the continued use of the Shin Bet program into January 2021.
You're setting a precedent. You're saying, okay, we can track people. Would you be able the next day to give up on this resource? Is it right as a default to give your security services this power? Or are you saying we're a democracy, we want to check other alternatives? I think this is the key issue. The greatest concern is that the result of the crisis, there will be greater pressure to increase the capabilities for non-terror related needs in the future with the alleged justification of saving lives.
However, it isn't just the government in surveillance overdrive. The pandemic has opened up opportunities for a number of private cyber intelligence and spyware companies, most of which are run by former members of the Israeli army. Many of them have worked with some of the latest tracking and surveillance technology that are tested on Palestinians in the occupied territories. One of the most notorious Israeli cyber intelligence companies is the NSO Group, which claims to work with governments around the world to, quote, prevent and investigate terrorism and crime to save thousands of lives.
In fact, more often than not, NSO has been in the headlines because its high-end surveillance tools have been deployed by states against political activists, dissidents, human rights campaigners, journalists, even Amazon CEO Jeff Bezos.
In March, NSO started developing its first, quote, civilian product called Fleming, an analytics tool marketed to government agencies for tracking people's movements.
Fleming's powerful analytical algorithms examine confirmed patients' paths and their historical meeting points with others, generating a list of those potentially infected.
There are many, many cases of activists and civil society organizations and journalists being targeted and harassed and arrested using the NSO spyware. And so given that record, it's absolutely concerning to have them come around this time in the pandemic offering help with their technologies. Perhaps this is for them an opportunity to whitewash their image, to say, you know, we're there to help. We have a health pandemic, it's a global one, we have solutions.
As privacy rights got trampled in the stampede to create contact tracing apps, two behemoths of the tech world came together in April.
Engineers at Apple and Google have been working together to make public health technology that protects individual privacy, so that people never have to choose between their privacy and the health and safety of their community.
The two companies said they would offer contact tracing software to public health institutions and governments to build their own apps around. At the heart of the system is Bluetooth technology. When two phones recognise that they are close enough for a long enough period of time, they will trade an anonymous string of code with each other, called a key. Should one of the phone owners later input a COVID positive status into their app, the information would get pinged to all the phones that had been in its proximity over the previous 2 weeks. The keys are encrypted and constantly changing, but the most important point is that they never leave your phone, so there isn't a centralised list of who has interacted with who. The partnership has arguably created one of the most privacy-protecting technologies to help track the spread of the coronavirus, a smart move in both business and publicity terms. When I spoke with Evgeny, he brought the solutionist critique to the issue.
Now, I would say that it's not as terrifying to me as many other solutions would look. We have to try to reduce our dependence on solutionists, but we have to do it in full recognition of the fact that the public democratic power that can fill that vacuum currently does not exist in the strong form that it should have in order to kind of be resilient and survive. And if that post-solutionist vacuum, is not filled in by democratic forces, it will be filled in by the security state and the surveillance state, which in its kind of democratic implications is as bad as the solutionist, or perhaps more, at least dangerous for a lot of activists and dissidents.
The pandemic has provided a dual boost for the tech industry. At one level, it's presented governments and regulators with a distraction of global proportions, the kind that's thrown recent investigations into tech practices and disciplinary hearings off schedule and lower down the list of priorities. Second, it's been a huge business boost. Despite the many drawbacks in the way that tech is being designed and works in our lives, COVID-19 has helped cement the tech industry within the private sector, and it increasingly looks like it will remain that way.
It's impossible to think about technology, for example, as something that would not be provided by technology companies, because we think, well, what else could it be? If you're caught in this neoliberal paradigm, you would think that there is nothing outside of Google or Facebook, and the only other alternative would be some kind of centrally planned economy like the Soviet Union. And this is where solutionism steps in to basically say, okay, we have accepted this cost, if you will, of running the world according to the neoliberal template. And here is an app that will help us to mitigate and alleviate the pain and the costs of the neoliberal solutions.
There's a real absence or a real lack, for the most part, of people actually saying no to technology. What we've seen is that there are a lot of folks who feel as though there is an inevitability to this. The concern is that when you have really brilliant academics or very large companies deciding that these things are inevitable, what they do is they give political cover to the institutions who are then going to roll it out. If academics were saying this doesn't accomplish anything instead of this is how decentralization works, the public dialogue about contact tracing would be very different.
So I'm guessing, Sean, you wouldn't put a contact tracing app on your phone?
No, I wouldn't put it on my phone because I don't want to receive hundreds of notifications a day that I've loosely been proximate to someone who has tested positive. For me, privacy is an important protection, but what we haven't seen is a proven value proposition here. And so I wouldn't download it, not because I'm concerned about my privacy, but I wouldn't download it because I don't know what it would do.
During this pandemic, as both the public and lawmakers have grown ever more reliant on the technologies of Silicon Valley, the tech industry knows that this is its moment.
It's not for nothing that big leaders in this industry, like Eric Schmidt, the former chairman of Google, has now been saying that he hopes that this crisis has revealed just how essential and fundamental this industry is.
Imagine the pandemic without Amazon, without Google, without Apple, without Facebook. Go back to 1918, you'd be operating under great fear.
Ultimately, this industry will use the aftermath of this crisis in order to shape a much more favorable regulatory agenda for themselves.
I think all of us should be grateful that these tech companies are working really hard to help right now.
Unfortunately, I think they will actually find quite a lot of reception among general public. And that is just the consequence of policy decisions. We could have made different decisions 10 years ago, 15 years ago, where we would treat artificial intelligence or logistics or cloud computing as a public good, which would not make us so dependent on the likes of Amazon or Google or Microsoft. And we would be living in a very different world. And I would argue that world would be far more democratic, because right now there is no way for us to have any non-market democratic say in how these infrastructures are governed, because they all belong to private companies.
The large number of unknowns surrounding the coronavirus pandemic can make it feel like a problem too big for us to grapple with. But what we do know, however, is that one of the best determinants of mortality is healthcare system capacity. And we also already know a number of ways to meaningfully invest resources into it. We don't need an app for that.
The most important things that are proving their value now are not things that we invented recently. We see good government communication. We see strong patient investment in the capacity of frontline workers. We see strong social safety nets and care networks built at the community level, at the institutional level, in a wide range of contexts. And of course, technology plays an important part in supporting those roles and in supporting those infrastructures. But the rush to invent something, the sort of push to the miracle cure or solution or whatever else, is often very distracting from, I think, the things that we know to be most important.
I don't want to downplay the role of technology here. Technology enables people to share information and to access information like never before. It enables us to have this interview. So it allows us to continue our lives with as little disruption as possible. But we don't want to live in a world that enables mass surveillance, and therefore it is our responsibility to understand that we're not just idle watchers. The pandemic is not permanent. What it will be permanent is how much are we allowing to go unnoticed and unquestioned.
We have built the world in the past few decades on the assumption that competition should be at the center of social coordination, and we have seen that the consequences of that are far from being positive for all of us. So re-embracing solidarity as a way to reorganize society as something very tangible and pragmatic that could serve as a guide and not just as an abstract idea would be a very good move.
Thank you so much for watching episode 3 of All Hail the Lockdown. This is a 5-part series looking at the complexities of our global response to COVID-19. If you'd like to check out the other episodes, episode 1 on capitalism and episode 2 on loneliness are available now. You can just use the hashtag All Hail the Lockdown. Next week, we're actually going to be looking at inequality, so I hope you come back and check it out as well.